Hey guys, it is Dr. Kre. Thank you for joining me today for the latest edition of the Dr. Kre and Me show. So come on in the room, tag a friend, share the broadcast. Today we're going to be talking about, hey Dr. Kre, I tested positive, now what? So it's another COVID-19 update, but we're going to be talking about what to do if you test positive and what does that necessarily mean for you. So I want to make sure to, hey Darlene, the numbers, I'm in Alabama, so the numbers are very high. So I think that this is a very important, topic. Once again, I want to say hi. This is Dr. Kre. I'm a board certified family medicine physician, and I specialize in helping everyday, overwhelmed, overworked people who are just struggling, trying to understand this thing called life. And I feel like through health education, when you know better, you can do better. So my job today is to talk more about COVID-19. I'm in the state of Alabama. Hey Chris, hey guys, thank y'all for joining us. When you get here, let me know where you're watching. I am in the state of Alabama, guys, and our numbers are astronomical. We are leading the way for new cases. So if you don't know anyone that's been positive for the coronavirus, then I just want you to wait a while. Wait a moment, like the old people say, just wait a while and you will see, you will know someone. Hey Lenora, you will definitely know someone that actually has the virus. I feel like it's getting closer and closer and closer to us. Every week I'm finding out about someone new. I have several close friends that are having positive, and it's been interesting to watch them. So today we're going to talk about, hey Dr. Kre, I tested positive, so what do I do next? So first and foremost, you need to notify any and everyone that you've been around in the last 2 weeks. I would say notify any and everyone that you've been around for the last 2 weeks, guys. If you've tested positive for COVID-19, notify any and everyone. So that means you're really gonna have to look back at your calendar, because since the world opened up, hey Jasmine, hey guys, hey y'all, thanks for watching on Instagram as well as Facebook. For those of you guys living in Alabama, numbers are crazy. We opened up here about May 15th. Everybody was lit and at the beach and hanging out and going out to eat and going to the bar and all of that stuff. Hey Jonathan. Everyone's been out and about, so our numbers have just continued to skyrocket ever since Memorial Day. So the big thing is that we were supposed to level out and flatten the curve. Our curve is not flattened. Our curve is continuing to rise, and I'm not sure that we'll be watching on for a second wave, but I think we're still in the first wave, right? So number one, if you tested positive, notify any and everyone. Notify any and everyone that you've been around for the last few weeks. We need to be mindful that this is nothing to be afraid of, guys. Right? This is nothing to be afraid of. This is nothing to be ashamed of, is what I mean. It's nothing to be ashamed of, nothing to be afraid that people will judge you if they know that you have the virus. Get out there and spread the word and tell everybody that you have it so they can get tested and they can be empowered. So number one, notify people you've been around the last 2 weeks. Dr. Michelle said, hey Dr. Michelle, she said numbers are high in Louisiana as well. Notify your job. I know a lot of people are like, my job don't need to know. However, just think about it. Even in our profession, we wear our masks when we're in with patients. We wear our masks when we're with strangers, but you do not wear your mask in the bathroom and you do not wear your mask in the break room, right? So if you're around your co-workers, they can give it to you. Your co-workers can bring this virus to work, right? You could bring the virus to work. And trust no one. If they've been anywhere outside of their home, there is a chance that they could get the virus, that they can bring the virus to you guys. So you have to be mindful. So notify your acquaintances that you've been around. Notify your job. Now, their job may have a policy where they notify everyone else. Hey, Aisha. They may say, hey, we have to tell everybody because we want to make sure everybody is tested, or they may say we may not tell your name. But honestly, guys, if you've been out for 2 weeks, they're gonna know what's going on. You either have it or you've been exposed to it. Next, make sure to watch and treat symptoms as they come. So you may go to the ER and the ER says, hey, they give you a chest x-ray. You're not sick enough that you meet admission criteria, but you're sick enough that they say, hey, you need something for cough. You may need something for pain because you have these diffuse body aches. You may need something for nausea. They may even give you an antibiotic. So you have to just be very, very, very mindful of him, of your symptoms and what they're doing. Ask questions if you do not know what's going on. Ask questions, guys. Say like, now, why would you give me this? I thought this was a virus. Did you see some reason that I needed an antibiotic? Did you see some reason that I needed something else? Or what are you didn't give me anything for my aches and pains. What do you recommend? So you are your own advocate. Remember that. You are your own advocate. Make sure to ask the right questions, guys. Make sure to ask the right questions. And just any questions. I know you may be like, oh my gosh, this happened to me. Don't be afraid to tell people. Don't be ashamed to tell people. Because people, if they've been around you, they need to know. Okay? So number one, notify any of your family, friends, strangers, anybody you can think of that you've been around in the last few weeks. If you went to a restaurant, call the restaurant and say, hey, I ate there 5 days ago and I ended up testing positive yesterday. Number two, notify your job. Your job has to do certain things to make sure that they keep everyone else safe, right? Because you're not wearing a mask while you eat. You're not wearing a mask in the bathroom. And that means those are places where you still can transmit the illness. And number three, make sure if you're positive, you have the things so that you can treat your symptoms. What does that mean? You have your Tylenol on hand. You have maybe some ginger. Think home remedies that can help you if you get nauseated, help you if you're aching way too much. Hydrate. I've been telling everybody, if you're positive, drink your fluids. Hey, Latanya. All right. So number four, watch yourself closely and watch for any shift in drastic shifts, drastic changes, because you may have to end up going to the ER. So you may be fine day 1, day 2, day 3, day 6, and then all of a sudden on day 8, you like, I can't catch my breath. My chest feel like an elephant sitting on it. I'm so tired, I can't hold my head up. I've been pooping water just diffusely, having all of this watery diarrhea, and I'm so weak, I can't even stand up. You need to go to the ER because they will see if you meet admission criteria. They can give you an IV so you can be as hydrated as you can. You have to really be mindful, guys, that this is serious. Hey, JJ Pruitt, make sure that you are taking care of yourself, right, guys? Make sure that you have your Tylenol. Check on your family and friends if they're positive. Check on them. Don't be afraid to say, hey, let me just drop off some vitamins on your doorstep. Here's a case of water. Here's some Gatorade. This is a hard thing. It's not to be gone through alone. It's already hard that we're having to social distance, but to isolate people if they're positive, to treat them like they are, have an extra horn, that's not fair. We're not going to do that because we won't want people to do that to us. So we're going to notify those people that we've been around for the last 2 weeks. We're going to notify our job, and we're not going to be ashamed about it. We're going to make sure that we're treating our symptoms. Remember, this is a virus. So if they hand you an antibiotic, ask the question, like, why did you give me this antibiotic? I thought this was a virus. Did you see some kind of bacteria somewhere? Watch yourself closely, as symptoms can change at the drop of a hat. You can be kind of okay, then all of a sudden you could be so short of breath you can't keep a whole sentence. If that happens, go to the ER. Next, hydrate, guys, and eat. Even if you don't feel like it, especially if you're diabetic, eat, get your protein in, Eat something, eat. And remember to sleep on your stomach. Sleep on your stomach. They found that if you're sleeping on your stomach, you can diffuse your lungs a lot better. You can get the air to the bottom of your lungs. But make sure to lay on your stomach at night so that you can actually get the air to places that you may not. If you're sitting up or if you're crunching over, hey Shay, if you're sitting up or crunching over, you may not be getting the oxygen in, and you may be kind of catching your breath because you may have coughed so much that it make your ribs hurt. So lay on your stomach, hydrate. And this is a big thing, guys. Next is nights can be the worst. Okay, so you may be feeling like, I got this, I'm more than a conqueror, I'm a winner. And then the sun goes down and you're like, what just happened? Why can I not catch my breath? Why can I not breathe? Across the board, any and everybody that I've talked to that's had the virus have said the nights are horrible. So something, I'm not sure why nights are much worse. Maybe it's because you're laying down. You're not getting the air that you should, be able to get. You're not laying on your stomach. A lot of people don't sleep on their stomach. So the coughing can be worse when you're laying back. You got all that drainage. Coughing can be worse. Your breathing can be worse. So making sure that you pre-medicate before you go to bed. Making sure that you know that, hey, it's about to be nighttime. Let me get my head in the game so I can go this long haul. It's a long 14 to 21 days, guys. It's a long time. This isn't the cold. This isn't just a little flu. This is all out war. Okay? So you got to be making sure that you're mindful and you know that this is going to be hard. So you may have 5 good days and then you like, what just happened here? I thought I was on the mend. I thought I could go to work. I thought I could go to the grocery store. No, stay at home. Stay at home, guys. Stay at home. Okay? So nights are the worst. Nights are much worse than your days. Remember to sleep on your stomach. Next, symptoms will wax and wane. You'll get your Tylenol in, that fever will go down, and you're like, yes, I can conquer the world. And that medicine wears off, and you're like, oh my gosh, I'm sweating, I'm hot, I don't even want my clothes on me. It is a heart disease. We're learning that, right? But I want you to know that if day 8 comes and you get worse, you get to the ER. Don't stay at home and say, I don't want to go and give it to somebody else. Go get the treatment that is necessary. And lastly, what if I'm positive, Dr. Kre, and I have absolutely no symptoms? That's a lot of people out there, right? So a lot of people are positive and they're like, well, I got it from, somebody else, but I have absolutely no symptoms. So that means you may not be shedding the virus at a higher level compared to somebody that's super, super, super sick. But you can and you are likely shedding the virus. So you still need to be wearing your mask. Wear your mask. Regardless of what Governor Ivey said or the governor of your state, because people watch from all over, wear your mask. Wash your hands. Soap and water. Wash your groceries when you bring them in, before you bring them into your house. Take your shoes off, get out your clothes. We've been talking about this for weeks, guys. You know the drill. Don't get quarantine fatigue so much so that you set yourself up for attack. So stay on guard. Coronavirus is out there. Yes, the 4th of July is about to be here, and I'm sure there'll be fireworks, but don't let that deter you from the mission, which is staying healthy, staying happy, staying whole, and keeping our hospital bills as low as possible. Okay? So, if you're asymptomatic, you do need to let your employer know. You need to let the people that you've been around know. You need to be washing your hands. You need to wear your mask. And know that even if you don't have any symptoms, but you're positive, your employer will likely require that you have 1 to 2 negative tests before you can return back to work. So a lot of times they do that second test about 14 days out, and then they may repeat the test a couple of days after that. They want you to have 2 negative tests a lot of times before you can return to work. That's whether you have symptoms or not. So that may be 10, some employers are saying 10 days with the CDC, some are saying 14 days, but you're just gonna get yourself a little vacation if you are positive and you do not have symptoms. So let's review, quick review. I'm positive, Dr. Kre, so what am I supposed to do? 1, notify all of those that you've been around for the last few weeks. Number 2, notify your job, okay? They have to make precautions. They need to sanitize the place. We're not ashamed about this. We're not afraid to notify people. We don't care about being judged because we want people, healthy. We don't want to make anybody super sick. Number 3, make sure that you are treating your symptoms. Have your Tylenol on hand. Have your cough medicine on hand. Have your water. Have your ginger. Have whatever it is. Have all of that on hand. Number 4, watch yourself closely and watch for your symptoms that may get better, but if they worsen, at the drop of a dime, you get to the emergency room because you may need oxygen. You may need an IV fluid. You may need medicines for nausea and vomiting so you can keep your food that you do eat down. Be mindful that the hospitals can't help. The first 2 months we said don't come. No, go so you can live a healthy life, okay, guys? Let's see. Number 5, hydrate, eat, especially if you're diabetic. I don't care if you don't ever want to see a piece of bread, a piece of meat, water, Gatorade. Force yourself to get the nutrition. That could be the difference in being able to deal with this at home and having to be admitted to the hospital. Number 6, nights are the worst. Know that. Days can be fine. Nights are the worst. Sleep on your stomach if you can. That helps you to kind of perfuse your lungs as well as you can. Number 7, symptoms will wax and wane. They're gonna come and go. You may be good, and then 2 hours later, you like, I just hit a brick wall. So that is normal. You may have 2 good days, and then you back in the bed. All of that is a part of the course. There is no one treatment for it. There is no thing to say, I can tell you that tomorrow it's going to be better. This is a virus. It has a mind of its own, guys. And for that reason, we don't have the answers. We don't have the answers. You take the good Lord, take the medicines that they give you, support yourself through it, hydrate, eat, and have a testimony in the end, okay? And lastly, if you are positive but you have absolutely no symptoms, there's a lot of that out there. You still are obligated to tell your boss, tell your people you've been in contact with, wear your mask, wash your hands. You don't have the cooties, guys. You got coronavirus, and because of that, we need to, in order to end this pandemic, we got to be able to talk to people. We can't be afraid. We can't be scared. We can't be ashamed. Own it. It happened. It's no one's fault, but it's on us. It's our duty to tell those around us. And remember that if you do have a positive test, if you do have a positive test and your job finds out, because you're going to tell them, you're going to be on the up and up and tell your job. You're not going to go there and shut the job down because you didn't tell anybody. They will likely require you to be home for 2 weeks, for 14 days, and you at least have to have 1 or 2 negative tests before you go return to work, okay? So you're going to get your test, and you are asymptomatic, which means no symptoms. You feel 100% fine. You're positive. You notify your people, everybody, including your job. Know that you're probably going to be out for 2 weeks, but that's not a reason to go to Miami. You stay yourself at home because you could be contagious. You are contagious, likely. You may not be contagious as the person that wound up in the hospital, but you're contagious against somebody that has diabetes, that's overweight, that's got heart disease, that's got high blood pressure, that's got cancer. Don't hurt people, guys, because you're selfish. Don't do that, okay? That's not a good look. All right. Well, okay, guys, I think that's it. So I'm Dr. Kre. I'm your board-certified family medicine physician. Thank you for hanging out with me today and allow me to share a few nuggets through my Dr. Kre and Me show. You can catch me on the news any and every time they call me to talk about the things of healthcare. So I am a health expert as well. So I help you to live a healthy, happy, whole life. And I feel like when you know better, you do better. So I'm empowering you to know better because you're getting this education and do better. Thank you guys for watching. Follow me on Instagram. My Instagram is Dr. Kre. That's DOCTORKRE. I'll see you back next Tuesday at 2:30. Be encouraged. Get tested if you feel like you have symptoms, or if you've been exposed, go get tested. Don't wait it out. Don't just check your temperature. That's not cute, guys. Hey, all right, it's Dr. Kre. I love you guys. See you next week.